The Houston Methodist Coordinated Care team is really committed to providing these wraparound holistic support for their clients and their families.
We need partners, and we have found a highly valued partner with Care Partners because in the Medicare population, we know that a third of those over 85 years of age have some kind of cognitive impairment or dementia diagnosis. And in our collaboration with Care Partners, we're able to provide the highest quality of care, not only for the patients, but for their caregivers to benefit both of their health.
We rely on them. They're the ones that are usually the ones interacting a lot with families in their most vulnerable times. They connect caregivers to us, and oftentimes caregivers don't really know who we are, and so we rely on community partners such as Houston Methodist to provide that connection and that support.
When they refer to us, they are not just sending that referral out into the ether. They are following up. They're following up with us. They're following up with the families to make sure that services have started and that they are able to receive the services that we provide.
We work in a population health program, which means that we are given a population of patients. And in general, the population is too large to take care of one by one. So we have to find, as we work with those patients, those who have the greatest needs. And in working with our patients, we've identified those that have a social need and a social issue. Identifying those patients and referring them over to Care Partners allows us to free up more nursing time to work on a patient that has a clinical need.
We ask patients to manage 10 different medications. They're supposed to manage all their bills. They're supposed to not get swindled by these telephone calls and all these things, but no one really stops to investigate their cognitive status and how they're doing with managing these complex tasks. So I think if we can give clinicians more resources, they're more willing to look and ask those questions about cognition when they know there's something that they could do. It really helps to have resources.
We're giving them a brighter future by providing caring for not only the patient, but also the caregiver. And the feedback I receive is from the nursing teams that work with these patients.
One of the big pluses is how, after the Care Partners intervention, the family seems more comfortable. The family feels, okay, I have a plan now, this is what I'm going to do. And they actually feel more confident in being able to help their loved one.
Prior to this partnership, there's definitely a void because we weren't the expertise in this field. So we find out our patients have, Alzheimer's, they're struggling at home with their loved ones, they're having erratic behavior, outbursts at home, and they just didn't have anyone to turn to, and we feel helpless in turn. So just, being able to provide this Care Partner resource to them has been very valuable.
This valuable collaboration and relationship is just beginning. So by working together, I'm inspired that we're going to identify and help more people. And we're going to be able to develop new programs, and we're going to be able to actually track those outcomes and share that as a model of best practices.